Top 20 Nutritionist Interview Questions and Answers. These nutritionist interview questions offer a snapshot of what to expect from the interviewer during the interview. We have provided a sample answer to each question. 1. Why are you interested in this role? The interviewer asks this question to understand whether you are passionate about the job or not. In your response, describe your interests and passion for this job. Sample answer. My passion to see people adopt a good relationship with food gives me the interest to work in this field. I like helping people to overcome eating disorders to find lasting recovery. I desire to see people being able to cope with illnesses such as heart diseases, obesity, diabetes, etc. by observing what they consume in their diet every day. This role excited me because I saw an opportunity for me to help people. 2. What are the roles of a nutritionist? This question helps your interviewer to know whether you are aware of the duties done by the nutritionist. The best strategy to respond to this question is by stating the responsibilities of a nutritionist. Sample answer. A nutritionist determines patients' dietary needs depending on their medical assessment and history. The nutritionist advises the patient as well as formulating a plan to create a diet that meets the client's unique requirements. He or she creates a diet plan taking into account the budget, lifestyle choices, and medical needs of the patient. 3. What are the qualities that a nutritionist needs to be successful? The interviewer asks this question to find out whether you are aware of the qualities that you should have as a good nutritionist. State the qualities that a nutritionist should have as you connect to the job at hand. Sample answer. A skilled nutritionist needs to have strong interpersonal skills to effectively communicate client needs. He or she needs to have the ability to maintain a good relationship with clients. For a nutritionist to be successful, he must maintain a comprehensive knowledge of nutritional science and an inventory of supplies for the client's use. Strong communication skills are also vital in this role to enable the nutritionists to translate and communicate industry terms in a simple format for the client to understand. 4. What major challenges did you face during your last role? How did you manage them? This question gauges your ability to handle challenges. Demonstrate that you are willing to stay focused and diplomatic once a challenge arises and that you can stick to clear nutrition goals. Sample answer. One of the toughest moments was helping a client who had a compromised immune system. Through conducting research, I created a diet plan that included decreasing undercooked and raw foods and also increased omega-3 fats. However, the patient had given up on himself and didn't want to change his lifestyle. Using my strong interpersonal and communication skills, I convinced him not to give up but instead embrace and follow the plan I had created for him. After a serious discussion with him, he accepted to follow the plan and after 1 month his immune had improved. 5. Describe your daily routine as a nutritionist. The hiring team will ask this question to find out how you perform your duties as well as prioritize your work. It is a great time to project your organizational and time management skills. Sample answer. When I get to the office, the first thing I do is to check my email and voicemail messages to check whether there is anything that I need to respond to. I then begin my daily routines, which include processing doctor recommendations as well as medical assessments, creating meal plans for patients with dietary needs, working directly with patients and the families to evaluate dietary requirements, and delivering reports to patients regarding dietary determinations. 6. Describe briefly about your experience. This question tests whether your background matches the needs of the company that is recruiting you. Describe your work history as you connect to the needs of the company. Sample answer. I hold a bachelor's degree in nutrition science. For 5 years now, I have been working as a nutritionist in a hospital. I have minted good relationships with patients to ensure that the diet plans are followed. I have also been on the front line to educate the members of the public on how to check labels when buying food to make the best choices. Additionally, I have advised them on the tests that doctors can perform on them to check for deficiencies in their diet. My other daily routines have been processing doctor recommendations as well as medical assessments, creating meal plans for patients with dietary needs, working directly with patients and the families to evaluate dietary requirements, and delivering reports to patients regarding dietary determinations. 7. What kind of strategies and mindset is required for this role? The interviewer asks this question to know the attitude you have toward this role. Demonstrate that you are ready for the task and you have the right strategies and mindset for performing these tasks. Sample answer. Every nutritionist needs to know that the most crucial thing in nutrition is diversity and moderation and diversity. He or she need to emphasize how patients can consume all type of foods and observe the right quantity without taking excess. Additionally, as a nutritionist, you must demonstrate that you are caring, empathetic, and conscientious to be able to relate well with your clients. To be effective, you will need to work closely with other regulated health professionals. 8. What is the biggest challenge that you foresee in this job? This question will help your interviewer to know whether you are a clock watcher or an employee looking to grow skills and take new responsibilities. The best way to respond to this question is to discuss how you would like to be able to utilize your skills and experience effectively if you were hired for the job. Sample answer. Many challenges are facing this field. However, the main challenge is the availability of low-cost foods that are high in calories. The majority of the clients are fond of this type of food and they are reluctant to adopt new eating habits. However, I am ready for the challenge. With my ability to coach and communicate well with clients, I will educate those that I can on the benefits of having good eating habits using a layman language for them to understand. I will help them to follow the diet plan that I will be creating for them. 9. How do you stay motivated in your work? The interviewer wants to know the interests and values that keep you motivated. Explain the strong values that you follow while doing your job. Sample answer. My passion to see people live a better life keep me motivated. I feel so satisfied whenever I design diet plans for people and I succeed in convincing patients to stick to it. Every time I see people get healed through eating the right food and doing exercises, it adds more zeal to me. 10. Describe a time when you failed in this role and the lesson you learned. The employer asks this question to gauge your ability to own mistakes. The employer wants to know whether you are the kind of employee who blames others for their mistakes. Describe the situation, how you failed, and the lessons you learned. Sample answer. One of the major failures occurred when I was new in the career. A patient came to me for a diet plan since she was underweight and wanted to add weight. I formulated a diet plan and asked her to follow it without fail. The lady went and followed the diet plan, but after 2 months she had lost 2 kgs instead of adding more weight. When she came for review after the 2nd month, she looked disappointed by my plan. When I discovered that she had not attained weight, I felt sorry for her. However, this time I combined counseling and diet plan. Within 1 month she had added 2 kgs and was very happy. I learned that diet plans alone may not be effective. From that time, I ensure that I have counseled my clients before I can recommend the meal plan to them. 11. Why do you feel you are the most suited for this role? The hiring team wants to find whether your qualifications fit the needs of the company. This is the time to project your skills, traits, experience, education, and achievements. Sample answer. Besides having a bachelor's degree in nutrition, I have strong communication and interpersonal skills that enable me to explain complex things simply. I have a good understanding of science and a keen interest in the effect of diet on health. Previously, I have been a nutritionist in a hospital where I have been advising patients on special diets, examining the process of nourishment and the association between disease, health, and diet among other tasks. Should I be hired, I will offer a workable solution to clients as well as promoting healthy eating. I will use the skills I have earned, education, and experience to make this role a success. 12. Share with us your greatest achievement. The interviewer wants to know what you consider as success. Share your proudest achievement. Sample answer. One of my greatest achievements was when I successfully helped a woman who was underweight to add weight and improve her immune system. She was very weak at the beginning, but after following the diet plan, she became full of life and healthy. 13. Describe the steps you would take to motivate a client who showed little interest in their dietary practices. The hiring team asks this question to explore your coaching ability. Demonstrate that you can communicate well and motivate your clients. Sample answer. I would use my coaching skills to motivate the patient to follow the formulated diet plan. I will ensure that I have uncovered what excites the patient as well as what he or she is willing to work for. I will engage a combination of encouragement, positive reinforcement, goal setting, and accountability. 14. Tell me the information you would include in a dietary presentation to primary school students. The interviewer asks this question to explore your non-nutritional related skills. Demonstrate that you possess strong communication skills and that you can present information to a specific audience. Sample answer. Whenever I am presenting nutritional information to any specific audience, I always ensure that the information is tailored to their interests and needs. When addressing primary school children, I will ensure that the subject is fun. I'll talk about the different groups of foods, which of these are healthy, and the ones to eat in moderation. I will make use of examples they can well relate to, as well as giving them opportunities to ask questions. The more they get engaged, the more they will understand the information. 15. Tell me the type of plan you would create for someone who was chronically underweight and needs to increase the BMI. The interviewer asks this question to gauge how you can address the uncommon issues. Describe how you can handle the issue related to eating the wrong type of food. Sample answer. I have experience dealing with patients who are chronically underweight and needed to gain body mass. I understand that this occurs as a result of eating disorders and other psychological issues. Therefore, I will combine proper eating practices and counseling to address psychological issues. I know that this might take more time because of the complexity of the matter, but eventually it will be done. 16. Tell me situations when dietary supplements can pose a health risk. The interviewer wants to assess whether you can demonstrate attention to detail. Project how you can communicate with physicians to make sure that the dietary plans you formulate can account for possible health risks to clients. Sample answer. Some medications don't interact well with some minerals and vitamins. I always research the medications a patient is taking to ensure that I prescribe the right supplements. For instance, if a client is taking SSRI antidepressants, in the diet plan I'll omit foods that have known negative interactions. 17. What nutritional changes can you recommend for a patient complaining of bloating and feeling fatigue? This question allows interviewers to determine a candidate's knowledge of how food affects the body. Demonstrate ability to determine nutritional deficiencies as well as showing compassion to the patient. Sample answer. When a client is complaining of fatigue or bloating, I typically suspect this condition with eating saltier or carbs foods than normal. I also know that these symptoms can also relate to other health issues. Therefore, I request my patients to take me through their meal for the day, including collecting all details such as their water intake every day. After confirming that the symptoms are related to nutrition, I recommend that they take more water instead of alcohol, soda, or coffee. Additionally, I recommend that they eat healthy grains and greens. 18. If I crush a tablet, will I destroy any of its properties? The interviewer wants to test your knowledge of nutrition practices. Demonstrate that you are familiar with such practices by making sure that your response is clear and precise. Sample answer. Crushing a tablet does not reduce any of the tablet's properties. Sometimes, this is a good practice for patients who have difficulties swallowing tablets. They can sprinkle the powder on food or applesauce to make it swallow the tablet. However, if the tablet is enteric coated, it is not right to crush it. This is because the coat allows the tablet to remain intact while in the stomach so that it can break down in the small intestine. 19. What are the populations of people with whom you are most interested in working? The employer asks this question to find out if you are interested in working with the population they serve. Even if you have a specific category of people you prefer to work with, your response should meet the needs of the interviewer. Sample answer. I enjoy working with older people. I find that they've got a variety of nutritional needs and this can make the job challenging. However, older people are more interested in their health. They are always willing to follow the diet plan I design for them. I discovered that this is the population your company works with. Therefore, I believe that this will be a great fit for me. 20. Why did you leave your last job? This is a behavioral question that an employer asks to find out whether you are a good or bad employer. The employer is checking whether you have a good reason for leaving your current role. Demonstrate your value for work and a sense of obligation. Sample answer. I love my current employer. For the 4 years that I have worked with my current employer, I have gained a lot of skills and expertise. I am therefore seeking an opportunity with more challenges to help me grow professionally. I believe your company can offer me such an opportunity.